Hi, welcome to this video. It's a video that I've made on really covering what happens in medical school. Depending on the med school you go to, there might be differences, but I'm basing this on the place that I work, which is the University of Exeter Medical School in the southwest of England. So I hope you enjoy it, and we'll kick off. I went to medical school in 1977. And the popular imagery then, released about in the early 70s, was this kind of idea by Richard Gordon, series of books called Doctor at Sea, Doctor at Large. And it's really following a group of young medics. And they were taught by this irascible, bearded surgeon called Sir Lancelot Spratt. I'm not at all like him, even though I'm a consultant surgeon and one of his professors at the university. I mean, I don't have a beard, obviously. He's very different, but medical school is a totally different experience now. We don't wear bow ties. In fact, we don't even wear white coats. But I hope you find the experience, I think, not only enjoyable and fun, but educational. How long will your career medical training take? It takes about 5 years to finish your medical school in the UK. And then you have 2 years as a junior doctor, which is foundation year 1 and 2. If you go into general practice training, that's about 3 years. And then you come out as a GP. If you decide to stay not in the community, but in hospital-based specialties in medicine or surgery, that will take longer, usually about 5 or 6 years. And so you can calculate how old you would be depending on the age that you apply to study medicine and work your way through that. I'm basing everything, as I say, at our medical school in Exeter. This is our St Luke's campus, which is about a couple of miles from Streatham, which is our main university campus. We have about 2,800, maybe 3,000 students from different specialties working, not just in medicine, but in St Luke's. Streatham might have closer to 20,000. To look at all the medical schools, go on to the website that I've showed on there. There's about 33 med schools at the moment, another 4 or 5 coming on stream. Have a look. Wherever you go, you want your medical school environment, and I hope you come here, but I want it to be stimulating. You would want it to be stimulating, supportive, innovative. And generally, learning activities are in smaller groups, with a mixture of lectures and seminars and so on. And then, of course, practical sessions too. And then you'd expect to have some e-learning resources and so on, and elements of what it means to be a medic, to be a doctor. What are the professional aspects of care? And then your support would be coming at different levels depending on what stage of your journey that you are. But certainly your peers will support you, and more, as importantly, will your tutors and your facilitators. So some pictures just to show you that although you have some classroom-based learning, much of your time, certainly from the first or second week of your starting in your first year, may be community-based or hospital-based, and that's the Royal Devon and Exeter Hospital in Exeter where I work. Or the Royal Cornwall Hospital in Truro. We also have hospitals in Torbay and in North Devon and so on. So it's very coastal and I think a very beautiful environment. So you've got to start off with the basic knowledge, and so the life sciences are key. The concept is to make sure that everything that we teach is based within evidence. And whatever ology you're learning on, this is a beautiful little thing that one of our students produced, who called a schematic vate, salivate, and it's a lovely model that she produced of the digestive tract. And so the idea that you have teaching from a different way, different approaches, different styles of teaching complements the fact that we learn differently. And all we've got to do is to tap in. What we try to do, universities try and do, is to tap into you and what makes you tick. So we've got a session going on here looking, for example, at immunology. And the idea of having smaller group interactions with a problem-based setting, I think works very well. Not all settings are small. Some are whole cohort level teaching, and that has to be the case because the topic is such that it has to be delivered that way. But we cover the basic sciences and all the ologies, and that means that we can integrate the assessment of it, if you like, in a formative way. In other words, the scores don't necessarily count for your grades at the end, but it means that everything's not taught in silos. And that makes sense, because if you learn thing in a mixed integrated way, that's just how disease presents. So you might have someone with an immunological problem as a result of a bacterial infection, and this is showing some bacteria on something called a gram stain. So you've probably gathered that the basis of what we want to teach you at medical school is the patient. The patient is at the center and is at the core. And in this situation, for example, in problem-based learning, we might have a case story of a patient. They may be in a nursing home. They may have cognitive impairment. They may have dementia. So you would look at how do you break that down into different settings? You might be having a session with the Clinical Skills Resource Centre, looking at how you test someone's mental agility. You might have a lecture on dementia. You might have a lecture, part of the Life Science Resource Centre will be focusing your basic knowledge about the brain and about neurological control systems and so on. And so we go through a series of pathways, starting at the musculoskeletal system, the immune system. You can read them off there: the nervous system, endocrinology, and down to the respiratory, and then cardio, and then the heart and lung, kidneys, and the gastrointestinal tract. And in the second year, we kind of enlarge on those, enhance on those, and then so this has got movement and control. We're looking at host defense. If you like, it's mirroring the immunology, but we're now taking it into a much more wider, much more elaborate, much more energetic context, and ending up with cancer, the genomics of cancer, and aging and staying well, which is such an important topic, particularly with our changing and aging population. And of course, the mind and what influences the mind and how our brain function works, our body functions work. Increasingly, we recognize the importance of the microbiome, kind of are what we eat and so on. So we have a 5-year curriculum, and med schools do this, and you build up, you embed. It's a bit like strata. If you look at sedimentary rock, you need to have a core knowledge, you revisit that knowledge, and it allows you to embed more and so on. So you're building and building by layers. And then we go back to visiting that as you go through the curriculum, and that's really important. So year 1, classroom, but still community-based, so you have visits to the GP and sessions outside with real patient experience from very soon after you start. And in year 2, we run a series of 8-week blocks, again, mirroring the first year, where you have a mixture of clinical skills, and in this picture, someone's trying to pass, in a model, a catheter, which is a little pipe that goes to draining the bladder. You have time to discuss what you've done in your professional week with your colleagues. You've got some lectures coming in, time with the GP, where you've got time on task with patients, and then you're consolidating your learning in a little assessment at the end of that block, where you're doing that with each other. It's not marked, but it's actually a chance to revise what you've learned. But the biggest chunk of your 3-week block has to be getting an idea of the basic sciences, all the ologies, the immunology, microbiology, sociology, epidemiology, anatomy, physiology, pharmacology, pathology, and so on. We love small group learning, and we love or embrace problem-based learning. Like any system, nothing's perfect, but I think that it certainly gives you the basis of being able to question and scientifically inquire. And this idea of critical reasoning, critical thinking is really important for your career throughout as a medic. Communication skills are really, really part and parcel of what we have to do as a doctor, to engage with our patients and to be able to come across in a thoughtful, coherent, empathic, understanding way. And this whole idea of building this confidence and leadership is really integral to what I think we develop with PBL. So this problem-based learning and this scientific toolkit will hopefully stand you as a really sound intellectual repository for the rest of your life with some active learning. And the idea of working in teams when you're problem solving is really what it's all about. Nothing more illustrates this than the current pandemic with COVID, where collaborative research across the globe is happening in this way, not in silos, but in groups. And so we hope we will end up graduating you as being employable and skilled. The first thing that you'd have to start with any program is to work out what the words mean. And I'm really guilty of using inappropriate jargonese and lapsing into it. And I'm really sorry if I do that on this series of videos. I've made 3 or 4 and I apologize if I've done that. This wiggly picture at the bottom is meant to represent the fact that we're all on different stages of the staircase. Some of us will be higher up the platform in certain knowledge areas and others will be lower, and vice versa, and we switch. But the idea of integrating what we learn is exactly what happens. And for example, I've looked at the COVID case this minute. If somebody comes in and they're really sick and they're breathless, you're thinking what parts of them are affected? How does that link up with the physiology? In other words, how is the kidney affected by the virus? How is the lung affected? How does it affect the GI tract? We know patients have neurological and cognitive disorders after this too. How do you assess that patient? How do you make a management plan? And what are the ethics, for example, if you've only got 3 ventilators and 5 patients coming in? All these are part of that integrated learning, and it's just so perfect for real life medicine. So we hope that by engaging students, med schools will give you structured feedback and let you know where you are. So once you've got this concept of the language of medicine, for example, I'm focusing on anatomy because that's what I'm involved in teaching principally. We're looking at getting the students to be patients, to lie down to, for example, mark surface projections. Where would the organs be on the outside? You're thinking about having to do a biopsy, take a sample of the kidney. Where would the kidneys be? At what point would you find them? Where can they move to? When you breathe in, when you breathe out. And then every term we have a little spot test based on around anatomy, but integrated with other subjects. And so we set out some models, and the 16 on the screen is really the time clock, because we've got a minute on each station, and the students are working through them. We've got e-versions of this too, electronic versions, but the students actually enjoy it because it gives them a chance to actually try and put into practice and contextualize what they've been learning. And that's exactly what's happening in these pictures here. So we learn our anatomy for our medical school, not through cadaveric dissection per se, and many medical schools have moved away from that because of the time and the not just cost, but the fact that anything that you use has to be contextualized. You have to be able to see how this applies to real world practice. So I love this human resin preserved tissue. It's called plastinated tissue. So these are real people who kindly donated their bodies, which have then been resin preserved and dissected beautifully to show all the structures that we need to know and to teach on and to be able to share with you. I love this idea of people being engaged, and that if you say something, there's a thing called the Ebbinghaus learning curve, or the forgetfulness curve, and how quickly things go. So you do forget, but if you show somebody, they may understand. If you involve them, if you show them, they'll remember, but if you involve them, then they will understand. I completely subscribe to that. So that's kind of year 1, year 2. Sometimes we've now got students going in year 2 to Truro, but year 3 and 4, you split between working in Exeter and in Cornwall, in Truro Hospital, or in Cornwall Hospital. And it's again consolidating more of what you've been doing in terms of our clinical pathways in all the different subgroups of medicine. So it might be respiratory, might be renal, gastrointestinal, gastroenterology, and so on. And then you have special study units where you can focus on an area that you may want to develop and explore because it's really interesting for you. And clinical skills are continuing to develop. You're getting better at doing things to patients and examining them and making diagnoses. And there are a series of online masterclasses you can access. Year 5 is primarily for learning medicine on the job. What are you going to need to know and how you're going to be able to do that as an F1, which is coming up shortly at the end of your placement in year 5. And so you focus very much on the medicine and surgery and on critical care and of course in general practice and community work. And you can also spend time in the subspecialties. If you want to explore plastic surgery or ear, nose and throat as specialties, so on, you can certainly do that. You have a 6-week elective that you can choose where you want to go to in the world. And then the main emphasis is on doing the job. As early as year 2, just to give you a flavour, we might be integrating things, as I've suggested. So if I've tried to water the pictures down so they're not too gory. But if you have a gentleman here with a big cut from glass across his face, it's literally in a nightclub as the setting. We would be saying, what do you see? You're just literally describing what you see, describing the length of the wound, where it's going, and so on. The fact he's likely to be conscious and he doesn't appear to have any other injuries and so on. And then we're thinking about the structures that are at risk and how the face feels and how you might manage that patient. You might change the scenario, for example, and talk about his mate who's lost some teeth and how do you transport teeth and how do you get sensation in the mouth, and if you know about how you get sensation, how do you anesthetize those nerves? So that's starting very early on in your medical course, and I really think that's important because it's the practical application that's there. So what about the future? More and more universities across the world have been flipping their classroom for some years now, where you're coming prepared, having done a lot of the reading and the work before you get into the actual place. So you're not coming in passively, but coming in very active learners. And it completely makes sense because the amount of time that you invest when you're actually on task is easier to focus and consolidate what you've done. You can do lots of assessment and learning tools and modules, as you can see, that are available online. And Responseware increasingly used for sessions, including Kahoot and various other gaming platforms. All of it makes sense. Don't spend time working out what books you're going to need. Universities will give you a list of books that they recommend, or topics, or websites, or places to look at. So save that until you get there. I've loved my life and my time, and I'm loving my life as a teacher. These are some of our medical students from different years at a Southwest Plastic Surgery Conference. And what I love more than anything else is seeing these students graduate and grow and become junior doctors. They're different doctors. They're not the same students. They become doctors. I've just taken these slides because I think they just represent the transition of where you go. And these are some my trainees, my junior doctors, and one of my consultant colleagues who had a send-off party for me. So I hope you've enjoyed this. I hope it's been of value, and the details are on that slide. You are very, very welcome to come and look around the medical school, and we love to see you. Thank you for watching.